also been proven that if you do a circumcision, it reduces your risk of HIV, HPV, and HPV, which is human papilloma virus, it's what causes penile cancer. So if you can reduce those viruses, then consequently you reduce your risk of penile cancer.
And so, in addition to all of this, I, what would you say to a parent that has been considering circumcising their child? Maybe they have a lot of cultural beliefs that are hindering them from circumcising their pre-pubertal, if I said that word correctly, child. Or what would you say to that parent, in addition to what you said?
If you're not sure, just come in, have a word with us. I think any doctor can tell you the benefits and the risks. There's obviously risks involved with it, and for me, the benefits outweigh the risk. I mean, I was driving on my way to do my marathon this morning. I could have met up in an accident, got killed. But I knew there's a risk to everything we do in life, and you as a person should be able to calculate those risks and see if there's a benefit for you to do a certain thing. So for circumcision, if we tell you these are all the benefits, and we'll also tell you the risks about it, and if you feel, look, I agree that the risks are there, but I hear you about the benefits, and I'm willing to go ahead. So the main thing is to open up and address your concerns.
All right, so let's just delve a little bit into penile cancer before we close this conversation. As you had mentioned, it's one of the more common ones that when we talk about Movember, for instance, they like to mention at the forefront of it is prostate and testicular, and penile often gets left behind. But you did mention earlier that it's one of the popular cancers in Botswana. So I just want us to just do a little bit more of awareness around your penile cancer. Maybe if you can share a little bit more information.
Yeah, so penile cancer is common, not as common as prostate. We do see it, and the incidence is decreasing currently as well. It is associated with HIV. So because HIV rates are coming down, we see it, but it's not as prevalent as maybe 10 years ago. We normally get penile cancer from this HPV, human papilloma virus, and it forms your genital warts, and one type of the HPV, which is an HPV 16 or 18, can result in penile cancer. How does it present? Usually you'll see an ulcer, as I told you earlier. You'll see an ulcer, go and see a doctor. An ulcer can be due to 101 things. They will obviously assess it, they will treat it with antibiotics if required, and if it's not getting better, do not ignore it. Seek an opinion from the urologist, and we will usually biopsy it, and we can tell you exactly what it is. And based on the results, then we can determine what sort of treatment will be required. The unfortunate part that I've noticed, not only in Botswana but in other parts of the world, is when men are diagnosed with penile cancer, we basically do the biopsy and they come for the results, and then they disappear. They don't ever come back, because when we tell them about the treatment of what they will require, and that freaks someone out. I don't think anyone wants their penis chopped off, and unfortunately that is the way we treat it. But 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 that's the only way, and if life is important to you, yeah, we need to do it, unfortunately, but it has to be done.
Oh my goodness, I can imagine. And is there adequate, how can I say, counseling that is done?
Yeah, so what steps we know the patients don't come back. We involve their families, we involve the wife of the man. We repeatedly call them, reminding them they need to come back. And some do come back, most don't, unfortunately. And we don't ever hear from them again. So we don't know what happened to them. But yeah, that's what we see. And it's not just the GPH, it's almost everywhere in the world. Yeah.
That's very interesting. That's very interesting. So, in addition to, or rather, continuing on that conversation around involving the families, what what is the one thing that you'd say to a family of somebody who has just been diagnosed with one of these cancers, especially the late stages, 3, 4? I know that families have a tendency to, because you love this person, you're going to search everywhere for a solution and offer various types of solutions, some of them traditional, be it your herbs, your teas, etc. So, what is some of the advice that you can give to families that, out of love, let's say, they end up looking for every solution under the sun?
Yeah, so the main thing is they should go in together. I mean, don't leave the doctor's advice or oncologist's advice for the treatment you require. If you want to try herbs and everything, you free to, but it's not going to work, unfortunately. It might improve the quality of your life. It might reduce your symptoms somewhat, but is it going to cure you? Whoever tells you that it will cure you, they're lying to you. You know, if you go into social media, you see, you know, treatment for prostate cancer. You know, they sell it in a bottle or whatever it is. You know, there's no evidence that it works. You know, if there was evidence, we would have definitely used it as well. You know, currently, there's a lot of research going into herbs and roots, and there are some promising data coming out. And it's probably going to be used in conjunction with Western medication in the future. But I wouldn't, just rely on, you've been diagnosed with cancer and now you say, okay, I'm going to treat myself with pumpkin seeds. You're going to come back 10 times worse than you came to us the first time. And the purpose of us, when you're talking about stage 3, stage 4, those are cancers that usually we cannot treat. And our purpose then would be to improve the quality of your life, decrease your symptoms, and prolong it for as long as we can. And unfortunately, we're all going to die, one way or the other. And that's how life is. And we have to accept it. And it's never nice to see a loved one die, but everyone's loved one is going to die. There's no way out of it. And how you deal with an issue will make it easier when the issue arises. So my main thing is if a loved one has an issue, don't run away thinking that you're going to find alternative. Do it, no problem. Do find your alternative medication, but don't leave out what we know works.
Yeah, that's Dr. Maher, a very practical man. Let's just jump into this for a second.
Your opinion matters. Send a WhatsApp to 76281885 or SMS 16616.
Jim FM, hello.
Dr. Maher and the person inside there, how are you?
What?
Just ask him, if they chop it off, where's the man going to pee? He must explain that part to us.
Thank you, sir. Very interesting question there, Dr. Maher. I'm going to hand it back over to you.
Good question. I know this listener very well. I'm from Lubatsi originally.
Oh.
And I recognize this voice from Lubatsi.
Uh-huh.
So the way the person will pee, we reconstruct the urethra. So the pee pipe, we reconstruct it. And depending on the extent of disease, we don't normally have to chop off the whole penis. Sometimes just the head, sometimes it's just the foreskin, sometimes it's half of it, and sometimes the whole thing. So depending on where we have to remove it, that's how we plan on how we're going to reconstruct it. And so for most patients who still have a bit of a penis left, we reconstruct it such that they can still pee from the tip of the penis. If we have to remove the whole thing, then we make a new opening for you between your legs, and then basically for you to pee, you pee like sitting down, and similar to how a woman pee between your legs.
Okay. Thank you so much for all the knowledge that you've dropped here, Dr. Maher. I think in closing, before we get your additional details following the musical break, what is one advice? Actually, let's just take one more caller. Jim FM, hello. Jim FM, you're live. Yes, sir. Yes, sir. All right. Thank you so much. So you can go ahead with your question to Dr. Maher. Halea bathroom. Uh-huh. Error. Um, please repeat your question, sir. Nelere mai airang. Oh, okay. Oh, okay. Thank you so much, sir. If I understand this listener properly, he's saying that his testicles are. I don't know what to type. I think you should see what I'm trying to do there. Yes, they're retracted up. He says that they're sort of coming into his stomach.
Okay. So that's a condition called orchitism, where the testicles are during development stop from, so the testicles are produced in the abdomen, and from the abdomen they move down to the scrotum. So in the path of moving down, for some patients, it may stop halfway, and the treatment for that is an operation. And we usually operate on it when they're children, before 18 months of age, we bring it down usually. And after puberty, if that's the issue, we remove the testicle, if it's not in the scrotum. So the reason why we remove it is because, one, it's not functioning anymore, and the second reason is that there's a risk of testicular cancer. So those we need to go and remove up until the age of 60. So if the listener is more than 60 years, and you can just go to his doctor's for a normal annual screening. But if he's under 60s or post-pubertal with undescended testicles, they need to come see us so that we can do what's necessary.
Yes, descended and undescended is the word I was looking for. So I can imagine that that's what he may be experiencing. And Dr. Maher o le rotloetsa gore le go bona ba bongaka ke bona ba e leng gore ba tla le kwala prescription e gore le kgone gore le go bona ene Dr. Maher gona go GPH. Tota re le rotloetsa gore ha le lemoga gore gona le sengwe se e leng gore it is slightly or very abnormal, just go to your GP and o tla go kwala prescription e kana yone reference. Is it called referral? Re le kgona go bona thuso e maleba gona go GPH go Dr. Maher or his colleagues. So in closing, Dr. Maher, I think we've reached the end of our discussion. I'm so grateful for all of the knowledge bombs that you've dropped on us this afternoon and with regards to testicular prostate as well as penile cancer. What would you say to somebody that just discovered that they're in stage 3-4 cancer?
It depends what type of cancer we're talking about. Each one has its own different treatment and its own different prognosis. At the end of the day, having a diagnosis of cancer, it's not easy for anyone. We deal with it every day. When I have to tell the patient, you've got stage 3 cancer, stage 4, I'm not really worried because we have ways to manage it. But someone who's just come in and they hear that, they freak out, and our job is to obviously calm them down and tell them what to expect and what they need to do to try and get the best of what's left. For me personally, if you have an issue in life, don't run away from it. The more you run, the harder it's going to hit you. So that's basically it. Don't run away. You've got an issue, let's deal with it.
Thank you so much, Dr. Maher. That's Dr. Maher, but he's a urologist there by GPH. He was referred to us by our friends from Care for All, who are going to be having a free PCA tests pop up. PSA, I think PCA is something else. Yeah, PSA testing there by, I think they said the Fields Mall on the 29th of November. So, a lot of the reasons why batho ba tlhokahala kana ba hitlhelwa ba ya ko bongakeng ba itlhela ba le mo stage 3 and 4 is because they are not identifying these cancers early. But there are various campaigns that are being done all over the country. Dr. Maher here mentioned one that's being done by Diagnopharm yearly, annually by Jira. So, in his words, or to quote him, but not to get him in trouble, at this juncture, we have no excuse really to not be identifying some of these cancers early. So we're so grateful to our family there at Care for All as well as GPH there for sharing the knowledgeable doctors with us this afternoon. And it's not the end, but when November ends, it doesn't mean that it's going to be the end of us having these conversations. Thank you once again, Dr. Maher.
No, thank you. I had fun.
Thank you. We're going to be jumping into a song by Miss Abby, a brand new song by Miss Abby Bidua Bells. And on the other side of that, Patience is going to come in again for the news. And you know what time it is. At 1 p.m. to 2, we're going to be doing Youth Roundtable, which is a debate segment where we are building critical thinkers as well as communicators, as well as the eloquent youth. So you don't want to miss that one. I'll tell you a little bit later. I don't want to tell you now what the motion will be, but do stay tuned.
The latest sound.